Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello, listeners. Welcome to another podcast for patients, caregivers, and healthcare professionals. With the high increasing concerns of urinary incontinence symptoms that are highly prevalent among women and have a substantial effect on health related to the quality of life. Today, we will talk about the issues related to urinary incontinence faced by Indian females with an expert clinician, Dr. Sanjay Pandey. He is an expert in reconstructive urology, andrology, endo-urology, female urology, incontinence, and gender reassignment surgery. He has operated more than 250 complex reconstructive urology procedures, and today, Sir will give us insights on urinary incontinence in detail. Hello, Sir. Would you please elaborate on what is urinary incontinence?
Urinary incontinence is a complaint of involuntary leakage of urine. The term urinary incontinence thus refers to any type of involuntary urinary loss that one could have at different age groups. Of the 25 million adult suffering population from urinary incontinence, close to 75-80% of the population could only be women, which means that 1 in 3 women beyond the age of 18 could experience episodes of urinary leakage involuntarily in their lifetime. Concerns with the increase in the urinary leakage which happens during pregnancy, during childbirth, during menopause and thereafter is a lot related to the pelvic muscles weakening up as a result of the progression of changes which happens in the pelvis. This leads to increased use of diapers and therefore reduced quality of life for women in their very prime of life. Many people experience occasional minor leaks of urine. Others may lose small to moderate amounts of urine more frequently, and therefore urinary incontinence has been classified as stress urinary incontinence, urge urinary incontinence, and mixed urinary incontinence.
What is stress incontinence?
Stress incontinence is a complaint of involuntary leakage of urine, even on minimal effort or minimal exertion, which could be as minimal as sneezing, coughing, laughing, bending, running, jumping, walking up the stairs, which means women would develop incontinence as a result of minimal amount of exertion, which brings about a stress or efforts on the pelvis. Unfortunately, this is more or almost exclusively a women's disease, which could happen in their prime of life in late 20s, 30s to even 60s to 80s. Women therefore need to be informed and made aware of stress incontinence, a phenomena that actually makes their life quite miserable.
How common is stress incontinence in India?
Population studies show a prevalence of urinary incontinence in the range of 10 to 42% in Indian women, which shows a very clear trend towards an increase in the prevalence in today's world. About 1 in 3 women suffer from stress urinary incontinence at some point in their lives. The stress incontinence phenomena is a progressive phenomena, which with changes in the pelvis which happen because of hormones, because of multiple deliveries, because of menopausal changes, brings about a weakness that could be irreversible unless they actually worked hard towards improving it postpartum, which many a times could be a progression that could be beyond them.
What are the causes for stress incontinence?
Stress incontinence, which is a result of leakage of urine with minimal efforts and exertion, is brought about by loss of the mechanisms which determine continence. Urethral support, bladder neck function, and function of the urethral muscles are important coapting mechanisms which determine the continence of urine. Now, damage to the connection between the fascia, the muscles, the loss of the nerve supply to the muscle in that region, or direct muscle damage, all bringing about changes in the pelvis can bring about continence to incontinence. In addition, loss of normal bladder neck closure mechanism, which could be happening as a result of age and trauma, can result in incontinence despite a normal urethral support. So, causes of stress incontinence are age-related, are hormone-related, are injury-related, or are irreversible changes which happen as a result of the various aspects of change happening in the pelvis, more commonly and almost exclusively in women.
What may be the other reasons of incontinence for the urgent mixed urinary type of incontinence?
Other more common types of incontinence beyond stress incontinence are urge incontinence and mixed incontinence. Urge incontinence is a complaint of involuntary leakage of urine accompanied by or immediately preceded by urgency or a compelling desire where you can't hold urine. Mixed incontinence is a complaint of involuntary leakage of urine associated with urgency and also stress-induced leak with exertion, effort, sneezing, coughing, leading to symptoms of leakage of urine that happens as a result of stress incontinence. So stress incontinence and urge incontinence could combine together to become a more common denominator in middle-aged and mature Indian women who have mixed incontinence, a combination of both kinds of incontinence where they cannot reach the washroom, partly because the bladder urges them to go and brings about an urge incontinence, and partly because they would leak urine with minimal exertion of even getting up from the posture, getting up and walking to the toilet.
What is nocturnal enuresis?
Nocturnal enuresis is a complaint of involuntary loss of urine that occurs during sleep. Let's break up this subject into nocturia and enuresis. Nocturia is getting up multiple times at night and not being able to get sleep thereafter and getting up again and again. This is more common a phenomenon in elderly people who have milder sleep and who have production of urine which is more in the night, partly because of changes in the arginine vasopressin mechanism. Enuresis or bedwetting is more common in children. In the age group between 6 to 15 years, if children continue to still leak urine beyond parental care, it is partly because of the milestones have not reached where the brain and the bladder rhythm has improved completely. In these children between 6 to 15 years, a urologist is involved in behavioral therapy, which is brought up majorly by parents. At the same time, brings about pharmacotherapy to bring in the change in the rhythm and improve the bedwetting phenomena completely.
What is overactive bladder?
Overactive bladder syndrome is actually a triad, a combination of which could lead to a compelling behavior we would leak urine. In overactive bladder, the components are increased frequency of urination more than 8 to 10 times in the daytime. Urgency, which is a sudden compelling desire where you can't control urine and you feel like passing urine. You are at odd times and odd location, you would leak urine out. The third component is urge incontinence, which is a leakage of urine involuntarily where your bladder does not listen to you. You need to reach the washroom before else the bladder would leak out. And these kind of episodes are accidents where urine leaks out at odd locations and odd times, where the bladder contracts erratically in absence of any other pathology and any other irritant, any kind of an infection is called overactive bladder. So overactive bladder is quite a compelling phenomena where it could be a dry overactive bladder where you have more of frequency, you go to washroom more frequently, you have an urgency which you can not always postpone and you have to rush. On the other side, it could be a wet OAB where you leak urine as a result of the bladder contracting erratically and you are now a slave instead of being a master.
Can we prevent stress incontinence?
Yes, a good question. Can we prevent stress incontinence? So I always believe prevention is better than cure in medicine. Prevention of stress incontinence includes a huge amount of lifestyle modifications. For a woman, post-delivery, she should be aware that she needs to get back her pelvic tone and pelvic elasticity back, which means all the stretch which happened during the pregnancy of 9 months and the stretch which brings about weakness in the whole pelvic floor needs to be recoiled back by good Kegel exercises. So postpartum awareness about recoiling your pelvis is the most important phenomena, because after a first and then a second and a third childbirth, it could happen that the pelvic floor never recoiled back and always turned weaker and weaker, where you could have stress incontinence with the first pregnancy, which worsen after second or maybe a third pregnancy, adds on to more trouble during menopause, and at the age of 50s to 70s, you are leaking urine which is beyond you completely. High fiber diet, quitting smoking, losing excessive weight, and avoiding overindulgence in caffeinated and carbonated drinks and alcoholic beverages. A good Kegels exercise and pelvic floor strengthening are important aspects of keeping your sphincter and your muscles in check. In other words, gracefully aging also without any subset of changes happening around would still bring about weakness in the pelvis. And therefore, pelvic floor strengthening in women is more of a requirement because of the kind of anatomy women have compared to men. Women are exclusively patients who suffer from a kind of natural stress incontinence, which may be without trauma, without any changes. And therefore, a wake-up call towards prevention is a lot of lifestyle modifications, avoiding constipation and taking care of yourself, being aware of the phenomena and taking help in much earlier days of minimal stress incontinence that could happen to you as a woman.
What are the symptoms of stress incontinence?
So for the reasons of awareness, the symptoms of stress incontinence are classical. In other words, a woman between her late 20s to 70s who had multiple childbirths or who had vaginal deliveries or who possibly is an obese woman continues to leak urine with minimal amount of stress, which could even be getting up from the bed, which could even be laughing, coughing, bending, sneezing, getting up the stairs. issues which are about stress that brings about a compression to the abdomen and the pelvis. And because the pelvic floor cannot support the kind of aspects which it was used to support in the past, urine leaks out. So symptoms of stress incontinence are not uncommon. Unfortunately, the awareness is missing, and unfortunately, many a times women postpone this. If you have to bend down and pray, and you cannot pray because you are wet, in that the situation, you probably seek an early treatment. Otherwise, many a times it got missed out. So symptoms of stress incontinence could happen to women. I said 1 in 3 women in their late 40s to 80s could have some symptoms of stress incontinence. If it is progressive, if it is perpetual, bothersome, and if it is obviously making you wear diapers and pads, it's time to see your urologist.
When do you suggest that one needs to visit the urologist?
Your urologist in your city is interested in taking care of your urinary continence. So if you are now embarrassed with either urge incontinence or stress incontinence or mixed incontinence, which means your bladder behaves as a master and you are a slave. That means the bladder contracts erratically at odd times and odd locations, or you leak urine at coughing, bending, jumping, running, laughing, and this has made you quite embarrassed in your lifetime. Your whole social quality of life has changed completely. You're forced to wear diapers because of the involuntary leaks. Your important activities suffer and you're progressing on this ladder. It's important to see your urologist. In other words, don't live with incontinence. It's important to leave incontinence and get sorted out.
Is stress incontinence age and gender specific?
True. Stress incontinence is both age and gender specific. In other words, women have a different pelvic floor or pelvic muscle alignment compared to men. Women experience stress incontinence twice or umpteen times more common than men. It almost exclusively could be a women's disease. In other words, pelvis and the urinary sphincter muscles are known to weaken by childbirth, by changes in hormones, menopause, and not able to recoil as a result of the changes which happen. Which means that there are more episodes of urinary leakage and incontinence which could happen to women as age changes. And therefore, both age and gender specific issues happen to women because of the pelvic floor changes which happen almost naturally.
How is stress incontinence diagnosed?
The diagnosis of stress incontinence, frankly, is in the language of the patient. The woman who complains of leakage of urine with minimal stress is complaining of a stress incontinence. But yes, diagnosis needs a detailed medical history. We need to look at a lot of comorbid issues, the changes which have happened in the past. We need to do a good physical examination to assess the kind of leakage and the degree of leakage happening. The stress test, which we look upon as a very important stress, gives us an idea as to what is the quality of life and how much of a repair is required. The pelvic and rectal examination, the neurological examination, the urine analysis, the blood test, all are a part and parcel of the improvement towards identifying and labeling this as a stress incontinence. Thereafter, assessing the degree of stress incontinence, quantifying it around. The evaluation tests also are ultrasonographies, the urodynamic studies, the cystoscopy in the right and the individual cases where we need to take it to the next level of identifying the level, the degree, and the kind of stress incontinence, because many of these stress incontinence could also be with a component of urge incontinence where we need to balance that. We need to look at mixed incontinence as a combination of urge and stress and look at which to be treated first, which is more bothersome. And therefore, stress incontinence is diagnosed a lot by history, by examination, by evaluation, by dynamic studies, and finally looking at what therapy at what point in time, in what kind of age group, who can accept and take this treatment forward.
Is stress incontinence curable?
Cure of incontinence is brought about by your doctors, mainly your urologist and your gynecologist, by understanding as to what are you going through. Are you going through an urge incontinence and overactive bladder complex, or you're going through a stress incontinence, which is a long-standing or recent postpartum issue where your leakage of urine has only progressed, you are living in diapers, you leak urine with minimal stress. So your history is important. The history that you lay upon the table to your doctor gives an idea about the kind of state that you are in, which gives us an idea about the severity that you are in. The severity is thus addressed and evaluated by a set of investigations, which gives us an idea as to what level you could be and what therapy could be best chosen for you. In other words, we look at avoiding diarrhea. We look at urine examination, which is always a midstream and a clean cat specimen proving there's no infection. We look at a uroflowmetry as to what pattern you pass urine. Hope there is no obstruction to the flow of urine and not a very high residual volume left over after you empty your bladder. We look at your sonography and understand your lower urinary tract in terms of imaging, understanding your bladder wall thickness, your residual volumes. There's no debris in the bladder. In patients who can be treated thereafter, the treatment already starts. But in patients who are progress, who are quite down the ladder with a lot of symptoms, who have been long-standing into these, urodynamics is an evaluation which is a non-invasive or a minimal invasive evaluation of a dynamic change happening in the lower urinary tract to a urologist. If needed, these are taken forward step by step to identify your botherness and to quantify it. So a subjective and an objective assessment of your incontinence is taken up by your doctors. Once that is done, we look at modifying the lifestyle, we look at behavioral changes, we look at taking care of your incontinence head on. In other words, your incontinence treatment and your cure depends a lot on the state where you are in, and thereafter the evidence that is looked upon by the investigations done by the right doctor. And therefore, see your urologist with urinary complaints and get it sorted is the motto of the day.
What are the complications of stress incontinence if left untreated?
Complications of stress incontinence or complications of incontinence are many. They could be social, they could be physical, they could be psychological, they could be sexual, they could be economical. Women suffer from all this. For example, they could be wearing diapers and could get skin problems, rashes, skin infections, and sores, which because of a constantly wet skin as a result of a leakage of urine. Urinary tract infections leads to a situation of recurrence as a result of the entire area being soiled and being wet. Emotional distress experienced with change in daily activities and quality of life, which brings about so much of distress and embarrassment, living in agony and distress that probably never goes away. It disrupts your work, social activity, relationships, some things which actually worsen completely. So these are all complications which actually can be sorted out provided you get a cure. And cure is just around the corner. If you have looked at and probably seeing your urologist in time, you have stopped this agony which has been happening for a long time. It's important to identify stress incontinence, identify oneself, join and mix together this and probably see your doctor in time.
Can stress incontinence be cured by medications and meditation?
Stress incontinence is a curable disease. Therapies are available to cure or significantly reduce your stress incontinence and therefore improve your quality of life dramatically. Therefore, it's important to look at not living with diapers, not living with incontinence, rather than being aware and sorting it out once and for all.
Does pelvic floor exercises help in curing stress incontinence?
Stress incontinence is a surgical disease. To be able to treat something of that kind with medications and meditation may not be possible. Medications act as adjunct to other therapies of stress incontinence. Behavioral therapies are very important. Pelvic floor exercises are hugely important. But surgery to bring about changes in the entire coaptation mechanism, in the loss of the pelvic floor rhythm or the pelvic weakness, is always brought about by surgery. So stress incontinence may not be completely cured with medications or meditation or exercises alone. Yes, in the early days of postpartum incontinence, a great Kegel exercise therapy and course could probably help individuals to recoil because they're on the younger side. The pelvic floor learns to recoil after the stretch which has happened as a result of the postpartum changes. But progression of change which has happened at menopause, change which has happened over years, may not be possible to treat by medication or by behavioral therapy. These happen to be adjuncts. A surgery of a choice as dictated by the degree of the involvement helps you to get a cure and final.
When should a patient of stress incontinence be offered surgery?
Surgery happens to be the curative therapy for stress incontinence and is usually done only after conservative Kegel exercises fail in young women who actually are focused and attempting to get that sorted, but just the exercises and adjuncts don't work in them. They would do best with surgery because the pelvic floor is still strong. The Kegel exercise has not worked. That means the progression has happened. Patients who find significant leak to minimal amount of stress or need diapers or are in a neglected state of long-standing stress incontinence. A woman who are offered surgery who can be treated completely and they get laughter, the best medicine forever thereafter. So it is important to offer surgery as a therapy and cure for stress incontinence in the right and needy individuals, in the progressed and neglected cases, in long-standing cases.
What surgeries are done for controlling stress incontinence?
For women who have a pure stress incontinence, who don't have a pelvic floor descent, who have been attempting their therapies with conservative and adjunctive therapies, but have not got that what they could get, A sling surgery is something which has been commonly advised and probably has been used by doctors to treat stress incontinence. That's when certain movements or actions like coughing, sneezing, lifting weights, putting pressure on your bladder will not let you leak urine, which you are leaking regularly and probably are living in diaper. Out here, a urologist creates a kind of a sling, which is just under the vaginal wall, in between the urethra and the vagina, at the mid-urethral level, below the level of the bladder neck. And that is something which works like a hammock without an extra amount of pressure which is applied. And this hammock then supports the urethra which is undergoing a pelvic floor descent. Now, there are many such slings available in the market, and over the last 2 decades, I having used umpteen different kind. At this present point in time that I use the iStop brand from Medica Bazaar, I find it's a great kind of a texture, though it also comes from abroad. The kind of texture that the mesh has allows me to feel comfortable because it's something which has not eroded the urethra, which has not eroded the vaginal wall, which has stayed coapted in location where we are placed. We have seen the material quite soft and the edges quite well braided. So feels quite comfortable with something that you use regularly. And iStop has been a great leveler for very many women in this country over the last few years that we started using it. The last 5 years data on this results have been wonderful.
What is the message to the society and all women with incontinence?
Yes, there is a message to the society and to all women who suffer from incontinence. All women who listen to this happen to be ambassadors of a subject which is quite agonizing. Living in that discomfort where you could leak urine and where you continuously leak urine is quite a disaster. Incontinence may not be possible to avoid because it comes with age, it comes with various changes happening in the pelvic floor. It possibly can be taken to the right treatment in the right time. That means the delays can be avoided. Living with urgency, living with urge incontinence, living with frequency of urination, which troubles your life and you keep mapping your toilets and searching for toilets, is something which can be avoided provided you identify yourself in time. In doing so, you see your urologist who evaluates you, takes you forward in the journey of therapy to cure, and makes you a partner towards understanding that this is a lifestyle change that you take forward. So, urge incontinence and overactive bladder are completely treatable. There are medications, there are various minimally invasive therapies for early, for delayed and for refractory cases on the overactive bladder. As regards women suffering in silence in their most mature years to elderly years with stress incontinence, it is only important that we make them aware today that please don't live your life on diapers. Please don't live with urinary infections and with the social embarrassment of living within yourself and always wondering, why me? It is important that you make a difference to your life and bring your urinary tract health to a front row seat as a woman. It is important that you do this because living with incontinence days are over. It's time to leave incontinence and lead a better life. Thank you so much.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.